So the trauma narrative is a really helpful exercise that has the mothers do the thing that they least like to do, reflect on their experience in the NICU. Moms are 24/7 thinking about their NICU experience and thinking about the delivery and thinking about all of the medical procedures their baby has had, but not really having an avenue to talk about it. So what happens is they tend to ruminate on it but have no release. So what this does is it has them talk about it and has them share it in group, actually. So in the fourth session, we have them write this, and we split it up into 3 different sections. The first section is talking about the birth experience, so reflecting on when did you first find out there was a possibility you would have a preterm delivery? How did you feel when you found out you were going to deliver early? What do you remember about the birth experience? The second section is the NICU experience. So what do you remember about the first time that you saw your baby? What was it like the first time you went to visit them in the NICU? Any medical procedures that really stood out to you or really distressing to you in the NICU? Not even for your own baby, but also in an isolette next to you, because at Stanford we had an open bay. So there were not only parents experiencing the trauma of their own infant, but seeing infants next to them that were having some difficulties or struggling. Then we have the post-traumatic impact section. This section is really helpful in reflecting on ways in which the NICU experience has impacted their understanding of themselves as parents, their partners, and then also how they see the world in response to the NICU experience. So we have them write this out in session, and then in the 5th session, we have them process the trauma narrative.